Hello, and good afternoon. I'm Tom Prislak. From the people of Cedars Sinai, welcome to a candid conversation about COVID-19 vaccines and a very special edition of Embracing Our Community Live in partnership with blackdoctor.org. This is special for us because blackdoctor.org and Cedars Sinai are launching a new collaboration to bring this vital dialogue to the community, and because our topic is an absolutely vital one itself. We'll be talking today about COVID-19 vaccines with some distinguished panelists who will bring their unique insights to our program. The Embracing Our Community Live series and our collaboration with blackdoctor.org reflects three principles that we highly value. The first is that equitable access to quality health care is a moral and social imperative, an imperative that has always been central to Cedars Sinai's mission. The second principle is that access to quality knowledge and information is an absolutely critical dimension of access to quality health care. The third and frankly inspiring principle is that many passionate organizations, locally and nationally, care deeply about equitable access and are leading change. Those three principles are the springboards for today's discussion. Over the years, Cedars Sinai has been fortunate to enjoy a strong relationship with leaders from a variety of organizations and institutions in the African American community. In recent months, those leaders have spoken with us about the COVID-19 vaccine and how it is perceived in the Black community, and they are emphatic about the importance of providing reliable information about the vaccine itself. The more we learned, the more we felt that embracing our community would be a useful forum for our shared concerns. So whether you're with us today on cedar-sinai.live or on blackdoctor.org's social media channels, we appreciate your interest and your participation, and we hope that you find today's discussion worthwhile. Today, our panel is in the very capable hands of Cedars Sinai's Chief Diversity and Inclusion Officer, Nicole Mitchell, who will serve as the moderator for the session. Nicole, over to you.
Thank you, Tom, and welcome everyone. As Tom said, we are so grateful to our partners at blackdoctor.org for joining us for this important conversation. And we welcome everyone joining us tonight from across the country via the blackdoctor.org Facebook page and YouTube channel. Tonight, I'm honored to welcome two community leaders from South Los Angeles who are working to combat the COVID-19 pandemic that has had such a devastating impact there. You'll meet them shortly. But first, we are honored to welcome Dr. Cameron Webb, Senior Policy Advisor for Equity on the White House COVID-19 response team. He's going to be here to have a look at the federal pandemic response, including efforts to improve equity in vaccine distribution. We have a lot of ground to cover, so let's get started. One housekeeping note, wherever you are viewing our town hall tonight, whether you're watching here with us at Cedars Sinai or on the BDO social channels, please feel free to submit questions for our panel. We'll do our very best to get to as many as we can. And with that, let's begin. Dr. Webb, thank you so much for joining us tonight. Great to see you again.
Yeah, great to see you as well. I'm excited to be here.
Yeah, let's have a great conversation. So I want to start by asking you, we've seen it all over the news today, but today's announcement about the recommended pause in distribution of the Johnson & Johnson vaccine. What can you tell us about that? And if people have received the J&J vaccine, is there anything people should watch out for?
Yeah, definitely one of those, pieces of news that changes the conversation, right? So I think the Johnson & Johnson vaccine, we've been saying all along, we have 3 vaccines that are safe and that are effective. And I think today's news, after we saw about 6 different instances of folks having this somewhat rare case of venous sinus thrombosis. I think that what it did is it created a moment for pause. It created a moment for the CDC and the FDA to say, well, are those related to the Johnson & Johnson vaccine? They all happened within, a couple of weeks of vaccination. And so just wanting to do the due diligence and see if there was any impact. Now, we know that the clotting events happen at random in the population as a whole, but here I think there's an extra level of care we have to take when we see these events, particularly in the setting of a new medication, or in this case, a new vaccine. And so that's all that this is. It's a matter of doing due diligence. A couple of important points. That doesn't mean, for anybody who's previously been vaccinated, that certainly doesn't mean that you have anything to worry about if you got the Johnson & Johnson vaccine. These cases are exceedingly rare. We've got about 6.8 million cases or incidents of folks actually having the vaccine. And we're about 6 cases. And while those are really important for us to track down, it doesn't mean that every single person who got the Johnson & Johnson vaccine has some risk. The other thing is we, quite frankly, don't know that it's related to the vaccine yet. And that's the reason for the pause. The Advisory Committee on Immunization Practices is going to be convening. They're going to be talking about it, running through all of the data, getting a really good understanding of what happened in those 6 instances, and see if there's any connection with the vaccine. And as soon as we get information, we'll let you all know. One thing we've always pledged to be is transparent and to really shoot you straight. As soon as we get information, we'll share it with you all.
Well, and thank you for that. And thank you for ensuring transparency in these conversations. I think that's such an important piece, particularly as we're hearing everything on the news. So thank you for sharing an update with us. We really appreciate that. So let's go to a little bit of a personal question I want to start with. So have you been vaccinated against COVID-19? And if so, why did you choose to do that?
Yeah, so I was vaccinated the very first day I was able to get vaccinated at our hospital. This was in mid-December. And so my wife and I my wife is an emergency doctor at the same hospital where I work, and she and I actually went together. We were in the same room, got vaccinated at the same time. And for us, we had spent the previous, really 9 months at that point working on the front lines of this pandemic, coming face to face with this virus and the disease that it causes day after day. And I think that, yes, we felt like we had some protection from the gloves we were wearing, from the gowns we were wearing, and our masks and our face masks. But at the end of the day, that level of immunologic protection was really important for us. It was important for us to feel like even if the virus made it past all those other defenses, our bodies were equipped to fight the virus. And we spent a lot of time looking at the data, digging into the research that at that point, nearly 75,000 folks who had been involved in the trials between Pfizer and Moderna, and recognizing that, among all those folks, we found that the vaccines were both safe and effective. We found that 95% folks, it was effective in the Pfizer vaccine. And so we felt comfortable taking it, understanding those realities. And I'll tell you, as soon as we got the vaccine, we felt some relief, to be honest. And, for me, I didn't have much along the way of symptoms. I had some soreness in my right arm where I got the vaccine. But other than that, not too much. My wife actually had a little bit of a fever after the first shot. The second shot, she was wiped out for the whole day. So she felt really tired. She was in the bed the next day. We joked that her immune system is just better than the rest of ours, so it was ready to go. But within 24 hours, she was feeling better and good to go. And 2 weeks later, so by the end of January, we felt really good about the fact that we were fully vaccinated and we had some protection against this virus that we'd come in contact with just in our clinical work every day.
Well, and thank you so much to you and your wife for being on the front lines during this pandemic, and thank you for sharing just your experience. It's really important for all of us to hear. Now that others have been vaccinated and we're starting to see the world kind of open up again, is it time to remove our masks and start socializing and traveling? What are vaccinated people allowed to do?
Well, I would say not quite yet, right? I think that there are a lot of different things that come into play, a lot of different factors. The first is that we've got lots of circulating variants, and the vaccines have different levels of effectiveness in terms of the size of the immunologic response that they create. And so that's the first thing to know. As variants are rising, understand that there's a different threat level. The second thing to know is that we have, over 100 million folks who've received at least one dose of this vaccine at this point. But the thing to keep in mind is that if you have a 95% efficacy rate, that means that naturally there are going to be some people who still are able to get the virus, even though they've been vaccinated. And we see that. We're calling it breakthrough cases if you pay attention in the news, but it's really just a matter of the fact that they're not 100% of, it's not 100% efficacy, it's 95% efficacy, which is amazing as far as vaccines are concerned. But yet and still, it doesn't mean that you don't have any risk whatsoever. So as long as there are still high levels of circulating cases, you should use an abundance of caution. In a lot of communities, there are still high levels of circulating virus. And the other part of it is you're also keeping other people safe. And we said this from the beginning. We know it prevents the risk of death. We know it prevents the risk of severe COVID requiring hospitalization. But in terms of asymptomatic infection, we think it protects against asymptomatic infection. We don't know for sure. And so, we know that people don't get sick, but it doesn't mean they can't carry the virus in their nasopharynx or in their, on their person and can't spread it to other people. And so not everybody's vaccinated yet. So part of it is the same thing we've been saying all along. Yes, you have a goal and a responsibility of keeping yourself safe, but also keeping others around you safe. So I think the masks are still important. Now, CDC came out with some new guidance, and they jokingly refer to it as the hugging guidance. So for folks who are vaccinated, yes, they can go and spend some time with other vaccinated people indoors, which has been really good news for a lot of people. My wife and I finally went out and did that. We spent some time with one of our closest friends, a couple, and they're also vaccinated. And it was just nice to be around somebody else for the first time in over a year. We did that on Easter Sunday, and that was special for us. But I think just the same, you want to keep in mind that guidance. A lot of grandparents have felt really excited because they've had the ability to come in contact with their grandkids for the first time in a long time. Just understand the risk, especially if they're unvaccinated individuals. You have to keep track of kind of what their risk level is. So if they're high risk for COVID, you also want to keep them protected. If ever there's a question, it's safer to wear a mask, right? It's safer to kind of say, well, maybe not if there's a higher risk for an individual, or if you're certainly not trying to bring together multiple households in one place. That's not the goal. So it's not time to have a party. But I think in a very controlled and responsible way, there are now some more opportunities for folks who've been vaccinated to spend a little bit of time together. And then the CDC also issued some guidelines around air travel, which is also important. So you don't have to isolate or quarantine before and after travel if you've been fully vaccinated. So just a couple of the things that are, encouraging about getting vaccinated. And yes, it prevents death. Yes, it prevents severe hospitalization or severe COVID requiring hospitalization. But also, it enables you to have these opportunities to safely spend time with other loved ones.
Yeah, and I think that's the important piece that people really have been missing. So that is good news. So continue to wear our masks, wash our hands, and be mindful of who we're around, which I think is a big piece. So thank you for sharing that. Another thing that we're starting to see a shift in people's interest in getting the vaccine, and kind of simultaneously we're seeing younger folks who what we could call the young invincibles, thinking that COVID's not going to affect them, right? So how do we speak to this population to really encourage them that it's just as important for them to get a vaccine too?
Well, interesting thing has happened. We vaccinated at this point more than 75% of older adults, so over the age of 65, who've gotten at least one shot. And so that's exciting news. And as we've gotten older adults more and more vaccinated, an interesting thing happens on the COVID unit where I work at my hospital is that we have younger and younger patients. And we realize that this virus does still cause disease in younger people. Some percentage of them do still, and unfortunately, some do that. It's not always folks who have severe chronic medical conditions. Sometimes it's really completely healthy individuals otherwise who suddenly this virus really does a number on them. And so I think that it's important for young folks to realize that you're not invincible. And I think most people know that. I think, it's also one of those instances where be smart about it. Yes, vaccination is a really important key, but understand what's going on in your community. And if there are high rates of spread, well, that's challenging. If you've got a lot of spread of these variants of concern, some of the different variants of this virus that are, either spread more easily or cause more severe disease, also really important to just know what's in your community, what's in your neighborhood. But I think the key here is that young people are also a key part of our achieving that herd immunity, which is the term we've been throwing around. But it's not that we want to do it on your backs. I'm counting myself as not a young person anymore. I'm like 38, so I don't know where I fall in all this.
We're in that questionable stage there, Doctor.
I'm youngish, but I think
Yes.
that the idea here is that, you know, it's really important for younger folks also to get vaccinated, because that's going to help prevent the amount of circulating virus. And that's going to protect other folks who are older, where there's more chronic disease. The virus has less places to go. And that's how we beat this thing. So we all have a role to play, you know, wearing your mask, maintaining your distance, washing your hands, and getting your shot when it's your turn. Those are the 4 things you can do to help end this pandemic. And so I hope that people really take that on.
And I think a reminder that this virus does not discriminate, no matter age, race, or anything. So it really is important for all to take that vaccine when it is your time, like you said. So we do still have many people who are undecided about receiving the vaccine. Really some concerns around how quick it came about and how the development and approvals were somewhat rushed. What can you tell us about that?
I can tell you that as I was practicing last year and working on the COVID unit at the University of Virginia, it struck me that as we're looking at the development of vaccines, calling it Operation Warp Speed made me a little uncomfortable sometimes, because I was like, oh, take your time, get it right, you know. But what became apparent to me was that it's not that corners were cut on really checking the safety or the efficacy of this vaccine. In fact, it's building on over 12 years worth of research on mRNA vaccines. It's building on the realization that if we were going to have a pandemic, it was going to be either an influenza or coronavirus pandemic. And so the National Institutes of Health had been doing research and work on this for a while. And a lot of folks know the name Dr. Kizzmekia Corbett at this point. And Dr. Corbett was already doing research on coronaviruses. And that's what put her in this position. You know, that's what put her in this, gave her this opportunity to use that research, lean into that for the development of a vaccine using that mRNA vaccine technology that had been under development for a dozen years. And so it really was a matter of a couple of things being in the right place, the right stage of development, right in time for this pandemic, and then significant federal investment. There were a lot of resources that went into making sure that these labs had the resources that they need to develop safe and effective drugs, but it still went through all of the phases of approval, and it was approved ultimately under an emergency use authorization. But again, in those phase 3 trials, between the two of them, over 75,000 folks were vaccinated in those trials. And so I think that in terms of the speed, it is faster than what we're used to, but it's because of several of these dynamics, including it being under development for a long time. And I think that's where, you know, again, for me, long before I was willing to, when my mom asked me, should I get this vaccine, long before I was willing to say yes, that's the kind of research and digging that I did. I was just like, okay, was it developed too fast? And based on my reading, based on my research, based on my talking to peers and experts, what I believe is that it wasn't developed too fast. It was a matter of a couple of things lining up and then a lot of investment to get it over the finish line in time to do some good.
Thank you. Thank you for stressing that point that it's been in the works for a while. I think that's important for all of us to hear and remember as we have some hesitation still. You know, here in Los Angeles, our community was especially hard hit by the winter coronavirus surge. And later we'll be speaking to 2 local leaders who saw the devastation firsthand in their communities, especially for people of color and those who are on the front lines or essential workers. What can you tell us about how the federal government is really helping in terms of ongoing COVID response for those communities?
Well, you know, we're realizing and recognizing, really respecting the fact that all of this pandemic plays out in a very local way. And so in all of our efforts, you know, from a federal standpoint, we're doing a lot to support testing, a lot to support sequencing to try to make sure we know what variants are out there in circulation. We're doing a lot to give people access to therapeutics like the monoclonal antibodies that are really important treatments for folks who do get COVID, and we're trying to prevent them from getting sick and needing hospitalization. We're also doing a lot to support vaccination. And to do that, what we've done is we've identified, well, what are the places where we need to get vaccines so that people can have access? And one of them is those mass vaccination centers. And so we're partnering with communities, with localities, particularly the places that have the most economic disadvantage, or the metric we're using is social vulnerability index. The places with the highest social vulnerability are the places where we're looking to put these mass vaccination sites can do 6,000 shots per day. And we're leaving those sites there for 8 weeks, and we're making sure we're getting as many folks vaccinated in those hardest hit, highest risk communities as possible. We're partnering with pharmacy chains and independent pharmacies to make sure that they're able to get the vaccine out through their sites, because pharmacists are some of the most trusted professionals in our communities. And we know that people are used to getting their medications there. They're also used to getting their flu shot at a lot of their pharmacies. And so it made sense to use that as a channel. You know, again, at this point, we're over 30,000 pharmacies across the country where we have sites. Again, that the goal from the president is by next Monday, having it within 5 miles of every American. And that's really important. And then you add on top of that our federal qualified health center, community health centers. You know, when I was in my residency training in New York, I worked at a community health center. I know that it's a central hub for health information and access in so many communities that, again, oftentimes experience economic disadvantage, have been hard hit by this pandemic. And by leaning into those community health centers and saying, hey, you're the first kind of clinics that we're going to make sure has vaccine, that's really critical too. And we've been able to do that, again, by the end of this month. Over 950 federally qualified health centers will have vaccine provided by the federal government. This is in addition to what the states are already doing, the states who know those communities well. We're all working together, we're coordinating and collaborating, because there's a lot of work to do. There are a lot of people to get vaccinated, and I'd be remiss if I didn't mention this idea of mobile vaccination units as well, the kind of smaller, more nimble efforts to get vaccine where it needs to go. The best way for me to describe it is, you know, in a fire, you don't ask a fire to make its way to the water, you bring the water to the fire, and that's what our mobile vaccination units are. It's really bringing vaccine to people who need it. So those are the main things. Again, there's lots that we're aiming to do, but I think that that these, when you put them all together, can do a lot of good.
Yeah, and I think, you know, that answered a couple questions that I had around what you can do with helping remove that lack of access. So thank you for sharing that. I think the federal government is stepping up. It is exciting to see that 5 miles, you know, within every individual to have access to a vaccine. That's a big charge, but we're excited that you all are part of leading that for us. So thank you so much. I don't know if we have time, but I have one question, if you have a moment, that I would love to share with you from the audience. Does that sound good?
Let's do it.
Okay. So, Dr. Webb, my mother and I both got the Johnson & Johnson vaccine, and now I'm worried about this potential side effect of dangerous clots. What symptoms should I watch out for?
Well, you know, there are lots of different kinds of clots. So in these 6 particular instances, these are clots kind of in the brain. And so the symptoms would look or feel more like stroke symptoms. And so if somebody has a loss of the ability to speak or loss of ability to move limbs, that's where you see some of those symptoms that are similar to a stroke. But understand, you can also get clots for lots of different reasons, but we've seen with COVID, it causes clots in the lungs sometimes. So you can have clots in lots of different places. I would just say after somebody's been vaccinated, or really anytime somebody's been sick, one of the key things is if you see something, say something. If somebody's not quite themselves, just pay close attention. And again, I want to really stress this particular outcome that we've seen that's made all this press today. We're talking about 6 instances, 6 cases out of 6.8 million shots of Johnson & Johnson. So you're truly searching for a needle in a haystack. It's not really something that you should anticipate having. I think if I saw the math correctly, it happens 0.00009% of the time, right? That's a really, really small number. And so it's not something you should be looking for. You shouldn't expect that it's going to happen because it's incredibly rare, if at all related to the vaccine. Now, we're not at all saying we're going to dismiss it. That's the reason why we're pausing. That's the reason why we're digging into it. But it's just to say this is exceedingly rare, but it's something that we want to make sure, hey, if this is in any way connected to the vaccine, then we're going to change some things. But for now, we don't know that quite yet. So I would say you don't necessarily need to be on the hunt for this really, really rare side effect. Well, I can't even call it a side effect. This really, really rare outcome.
6 cases, that's it. But, thank you for sharing that. And thank you so much for your time. I know it's a little bit later on your side of the world. So thank you for being with us tonight and for all the great information you shared with us. So I appreciate you. And I hope our audience got a lot of great information.
Well, I'm happy to be here, and thank you all just for tuning in, for your willingness to hear more about the importance of helping us get through this pandemic. We're all in this together, and we can do this. So thanks for having me.
Thank you. All right, so now let's welcome our panelist from right here in Los Angeles. Dr. Elaine Batchlor is the Chief Executive Officer for MLK Community Healthcare, a health system that includes a state-of-the-art private safety net hospital, 3 clinics, the MLK Community Medical Group, community and population health programs, and a philanthropy foundation. Her innovative work to increase access to underserved populations has been recognized nationally, earning her membership in the prestigious National Academy of Medicine, an academy committed to advancing health science and accelerating health equity. Of course, MLK has been on the front lines of the pandemic all year and throughout the winter surge, fighting COVID-19 in South Los Angeles. So we are eager to hear from you, Dr. Batchelor. Thank you so much for being here with us this evening. And I'd also like to welcome author and faith leader, Dr. Kenneth Ulmer, Bishop and Pastor of Faithful Central Bible Church and CEO of the Ulmer Institute, whose ministry has grown tremendously over the COVID-19 pandemic to tens of thousands via his many online services. I am also proud to report, building on his friendship with Dr. Batchelor, Bishop Ulmer's congregation has been donating PPE, or personal protective equipment, and other supplies to MLK Community Hospital, helping to support the fight against COVID-19. So a huge thank you to both of you for being here and sharing the afternoon with us. I'm excited for us to have conversation. Nice to see you both again.
Thank you. Good to see you. Thank you for having us.
Thank you.
So like I did with Dr. Webb, I'd like to start by asking you both a personal question and tell us a little bit, have you been vaccinated for COVID-19 and why did you get the shot? Bishop Ulmer, let's start with you.
Yes, I have, and my wife has, and my kids have, and everybody has. But the why is really important. And for me, not only did I, but I made extra efforts to make sure that our congregation knew that I had gotten it. I wanted to be out front with it. We had a conversation with Dr. Corbett and several doctors similar to Dr. Webb from around the country back when this thing was very, very early. As a matter of fact, I remember a few months after it started, we delivered some masks to Martin Luther King Hospital, and Dr. Batchelor was involved there. And we thought it was going to last for a couple of months, and we'd be back to business as usual. We know how that worked. But I think my point is that our community has not only been affected disproportionately with the virus itself, but the high incidence of hesitancy, in many cases, even fear. And so I wanted to make sure that our congregation and our constituency knew that I had taken it. And as we speak, I'm in a process now of working with some public service announcements from clergy and celebrities to just say, get the word out. My issue is very personal. I'm tired of doing funerals, and I've seen the on the flip side of what Cedars is doing and the medical profession is doing. And I just really, as a friend of mine in Chicago says, I want to do more vaccines and less funerals.
I think that's a very personal and a good reason to spread the message. Dr. Batchelor, how about you? Have you been vaccinated and why did you choose to do so if you have been vaccinated?
Yes, so first of all, thank you for inviting me to be part of this very important conversation. Similar to Dr. Webb, I got vaccinated as soon as it was my turn. As you know, healthcare providers and healthcare workers were in the highest priority group for vaccinations. So we vaccinated our staff first. And as someone who's running a hospital that has been at the epicenter of the COVID pandemic, we were really thrilled to be able to offer the vaccine to all of our staff, everyone from housekeeping, security, food services, nursing, physicians, anyone who was on the front lines of caring for COVID patients or helping us provide services to COVID patients got a vaccine. And after we vaccinated our staff, we also opened it up for family members who were in the appropriate eligible tiers as well. And some of our staff literally cried when they got their COVID vaccine. They were so grateful to be protected and to be able to visit their loved ones who many of them had not seen for a long time. I personally felt very relieved when I got my vaccine. My husband, who is a criminal trial lawyer and works for the public defender's office and has been an essential worker, told me that after he got his first shot, he was finally able to sleep through the night. He hadn't realized how stressful it had been for him to be exposed to COVID on the job and to finally get vaccinated. So just a big sense of relief and gratitude for this amazing gift that science has given us.
Yeah, I agree. And thank you to you and your team for being on the front lines. And I love that you opened it up to family members too. I made the personal choice. I am actually almost 9 months pregnant, and I'm fully vaccinated. And after, I had some hesitancy and questions at first, but I had a really great conversation with my OB and educated myself about just why is this so important? And I have a big sigh of relief vaccinated. And, now, even though women weren't really included, pregnant women in some of the earlier studies, we're now seeing some of the benefits that are being passed on to babies through breast milk and through cord blood that is giving them a bit of protection. So that makes me feel even better about my choice. But it was through a lot of just like the two of you, education and being grateful that science provided us, Dr. Batchelor, as you said, with this great gift. So I do, if there's any pregnant women out there hesitant, it's a personal choice, but please know that there are lots of benefits.
Well, good for you, because pregnant women are in a high-risk group if they do get COVID for having more severe complications from COVID. And so far, what we know about the vaccine is that it is safe for pregnant women. So congratulations on making that choice.
Thank you. I think I had a sore arm and some fatigue, but I wasn't sure if fatigue was from that or from being pregnant. So, Dr. Batchelor, so with 3 vaccines currently available, is there one vaccine that you think is better than the other?
Well, I think the best vaccine is the one that's available to you. And we do know that we're pausing a little bit on the Johnson & Johnson vaccine for the reasons Dr. Webb outlined. But I believe that this pause will be short. And I think at most, there may be some advice that comes out for premenopausal women to get an mRNA vaccine, which would be Pfizer or Moderna. But I think we'll then go back to vaccinating. We have been at ground zero of the pandemic in South LA. It's a low-income community that is primarily Latino and African American. And we know those communities have been disproportionately impacted by COVID because they are essential workers, because they live in crowded housing and have had difficulty isolating, because even before COVID, our community has been the location of a public health crisis, which is an epidemic of poorly treated chronic illness. And for all of those reasons, it is really critical that we get the vaccines out in our community. So now that our COVID volume has gone down, we have a laser focus on getting folks in our community vaccinated. We've been deploying the Johnson & Johnson one-shot and you're done vaccine at a number of mobile sites that we set up based on our own hot spotting, which means, we have a lot of data about where we've seen patients with COVID. We know where the hotspots are, and we're going into the community to give vaccinations at those hotspots. Those might be near housing projects, grocery stores, boys and girls clubs, churches, senior centers. And for some of these locations, the Johnson & Johnson vaccine is preferred because it's easier to store and you get one shot and you're done. But we're offering people a choice. We also have the Pfizer vaccine. And if people prefer to get the Pfizer vaccine, we're happy to give them the Pfizer vaccine. So it's really a matter of personal choice, but my own opinion is that the vaccine that's available is the best vaccine for you.
Right. And you're meeting people where they are too, to make sure that they have access. And I think that's an important piece of that. Bishop Ulmer, as Dr. Webb shared a little bit earlier, we're seeing a massive effort to increase access, right, to vaccines, including Cedars Sinai partnering with MLK Hospital to help provide some of those pop-up clinics. Are the vaccines reaching your church members and community in Inglewood? And what is your congregation doing to increase access?
You know, a couple of things. First of all, our church itself, we have, now almost a month, we've been providing we've been a mobile site in our community, and we've offered the vaccine, almost a month for the last month now. We're seeing an interesting thing, though. As the accessibility grows, and I commend those, from government levels to state government and state government, local, et cetera. But as that increases, we're seeing an interesting tilt now, because I know of several churches, and one of the things that we were promoting is that one network of a trusted site. We talked earlier about going to your local pharmacy, your local drugstore, making it accessible 5-10 miles, whatever it is in terms of the accessibility. Well, the next, certainly, if not the most, but certainly in the Black community, the most prevalent sites would be with the church community, almost every corner. But what we're learning is that many churches here in Los Angeles, I'd say many, several that I know of, that have been hosted, that have been sites, they have ended up not having the number of people turn out. I mean, I know a couple of churches that were contracted, if you will, or agreed to do 500 tests a day. And I know several of them who've only done 150, 200, et cetera, and very few have been able to meet that. So what we're finding is now that accessibility is increasing, also there's this increasing issue of hesitancy and fear and not ready yet, and I'll wait till later. And so there's an interesting dynamic going on in the community that we've been serving, and that the more accessibility there seems to be being met with a lot of hesitancy, and we're trying to address that right now. That was the whole thing I meant about letting people know that I've taken it. And so there's a trust factor that is very, very important with this whole scenario. The trust factor in terms of the community, trust factor in terms of our leaders, in terms of Black doctors, et cetera. So all of these are now converging at a time when, in the middle of all of that, we now hear today about the J&J issue, and my phone's been buzzing all day. Pastor, you've been pushing it. What do we do now? What do we do now? And so I think there are still some challenges that we're facing, and yet we're dealing with them one at a time and as they come.
Yeah, it is an interesting dynamic, and to both of you, you kind of touched on it, Bishop Ulmer, but we're seeing hesitancy for sure in the Black community, or is it simply kind of a lack of access issue? I'm just curious what you think, and how we really continue to work together in the Black community as those trusted partners to ensure that education and awareness and access continue to grow, to make sure we get shots in arms and everybody vaccinated. So just kind of would love your thoughts on that. Is it a combo of the two? Are we seeing one kind of outweigh the other, access versus hesitancy? Dr. Batchelor, you want to chime in?
I think it's both. We've got both access problems, and we've got some hesitancy. And, particularly in California, where there's an online system for enrolling in the program to get a vaccine and learning about the vaccine locations, that has presented a barrier to some communities. And one of the reasons our vaccination program has been successful is because we have not required community members to enroll online. We use grassroots communication targeted to our community. We tell them, walk up and get a vaccine. You don't have to make an appointment. We will collect the information from you and enter it into the public health system. We want to make it as easy as possible for people in the community to get a vaccine. And initially, there's also been shortages of supply. So I think there have been access barriers. I think that once the supply increases and we've vaccinated, sort of the early adopters, then I think we're going to have to tackle the people who are more hesitant, the people who are waiting and seeing. And I can tell you, I have personal experience with that because my 92-year-old mother lives with me and she has still not gotten a COVID vaccine. And she's a very educated woman. She watches CNN 24/7. So she has all of the news and information, and she's still waiting and seeing. So I think we're going to have to continue to educate people and show them that these vaccines are safe and effective, and that it's the smart thing to do for yourself and for the whole community.
And I think that's why conversations like this are really an important piece of that journey.
Absolutely. Mm-hmm.
Yeah, I think there's another, and I certainly agree with Dr. Batchelor. I'm seeing each of those levels, the accessibility issue, the hesitancy issue. I'll tell you something interesting though. In my circles, there's another layer. There's another layer that figures into this equation, and that is, especially with many of our seniors, and we've bent over backwards to make sure that our seniors are getting back and they're getting the transportation, whatever. We've had our young people work with them in terms of doing the whole online and the computer thing. But there's a whole nother piece in my circles, and that is I have a significant number of people who they hear all the information about the accessibility. They know where they can get it, they know how to get online. But I have a bunch who are saying, I'm just gonna trust Jesus, and I'm gonna hold on to the Lord, and I'm gonna pray, and the Lord's got me covered, And so we're dealing with that whole issue, and so I'm trying to say, well, the Lord is responsible by giving you a way to go down on the corner and get this shot. That's one way the Lord is in this thing. But I'm just saying this, it's so multi-layered. And I think Dr. Batchelor hit on the head. It's not so much one issue, an either or. There are several layers to this thing, and we're just taking them as they come.
And I think that's such an important piece, right? This is God showing you, here's an opportunity. So let's make sure that we take advantage of it, and, enjoy that gift that we've all talked about. Bishop Ulmer, Dr. Batchelor touched on it a little bit around internet access, or what some are calling the digital divide, and how that really plays a role. So many sites are using, registration for appointments, and we hear stories about parents and grandparents who don't know how or don't have the help to sign up. How can we help people get vaccinated and really sign up for their vaccines? And Dr. Batchelor, you talked about, what you're doing over at MLK. Bishop Ulmer, what have you all been doing there?
I think a couple of things. First of all, I think it is valid to assume that there will be many, certainly seniors, who don't have that capability, who don't have that expertise, whatever. And so we have matched up our young people, our, computer whizzes, in many cases, with the seniors in our church. We've had online seminars, we've had Zoom conferences, et cetera, directly targeting our seniors to help them. We've walked them through this thing. We've helped them, to how to become more comfortable with it. As a matter of fact, I tell you what's funny. We were concerned about some of our seniors missing it until we found out how many of our seniors have Facebook accounts. So I mean, you never know what, And so you kind of got to put this thing together. But it's right. Multi-layered, and we have tried to give those services both in seminars, both in one-on-one, because I think it's not a good time to assume that they know or they get it. All right, and then once we've done that, then especially the first couple of weeks that we had our church as a site, a vaccination site, then you had, I think it was the state or the county, one of them, but one of the online systems crashed. And people were coming and they couldn't get online, or they had reservations, they had appointments that got canceled, and so you got all that mixed up. And so when you figure what goes through the mind of a senior who has struggled to just get into that thing, and then they get into it and they can't go, I can't tell you how many we had who came and we didn't have any. I've seen them cry. I know one of my mothers literally cried. She said, but Pastor, what are we supposed to do? And so there's this frustration element that we have to continue. It's almost as a case-by-case basis, but it is a real issue, the whole computer and online element of this thing.
So we have to find that dynamic of kind of the online, but as Dr. Batchelor and you are doing, meeting people where they are to make sure that we're supporting them. Dr. Batchelor, some people have the walk up part. I think that's an important piece to this, really, to help really alleviate some of those access issues for sure. You know, Dr. Batchelor, some people have fear about these vaccines from concerns, and we talked a little bit about the speed of it with Dr. Webb, but the concerns about side effects to whether or not they'll be effective against some of the new variants that are out there. How can we help really get rid of those fears for people?
Well, Dr. Webb really hit it well. He described the process that resulted in the vaccines, and it's based on more than a decade of basic science research and just amazing science. We do know that there are variants out there, and actually we are in a race to get as many people vaccinated as possible before we see the emergence of variants that are resistant to vaccines or that are more lethal than the original COVID virus. To date, we've seen good, pretty good coverage of the variants with our existing vaccines. So I don't think there's any reason for people to be hesitant or concerned that the current vaccines are not going to be adequate. I think they're demonstrating to be adequate at this point. But the longer we go without reaching herd immunity, the more opportunity we give the virus to continue to mutate. And eventually, if this continues, we may see the emergence of some strains that are resistant to the current vaccines. Now, another piece of good news, though, is that the new technology that's used in these vaccines makes it much, much easier to modify the vaccines and to target new variants. So Moderna and Pfizer are actually working right now on testing some modifications of their vaccines to target some of the variants. And that's something they can do. But obviously, the logistics of going back and getting everyone vaccinated again would be pretty huge and would take time. So we need to get in front of this by getting to herd immunity as soon as we can.
Yeah, thank you for that. And such an important piece for us to all remember. Let's get ahead of this, everybody.
Yep.
Bishop Ulmer, people are a little exhausted and a little tired. And there's been so many that have been isolated after a year of quarantine, right? We've been kind of staying in our homes. In addition to communicating about the vaccines, how can faith leaders and others like you and folks in the faith community really help people during this difficult time? I think there's a lot of concern about mental health and us feeling lonely. So any advice there?
Again, I think it's a matter of acknowledging some of these realities that maybe we had taken for granted. I had an interesting conversation with a friend, member of our congregation, who expressed to me, she said, Pastor, you don't understand what it has been like to live alone. You live by you're a professional person, whatever. You can't go to work. You can't go to school, whatever. And so you're living alone. And so I got to be honest, I didn't think about that dynamic. The fatigue is there. The frustration is there. Let's go all the way. In many cases, the depression is there. I cannot tell you how many. We have a professional counseling center, and our counseling center has been busy just with the whole depression element of it. And so there's this multi-layered response to the thing. I think, again, what you do is that you have to be proactive about it. I love what Dr. Batchelor said. The pharmacies are already ahead of the variant. They're making adjustments and shifting along the way. And so in our area, we're learning. We're almost having to redefine how we do ministry. Ministry is no longer how many people can come to a church, how many people sit on a pew, how many people come to services. It is how do we go to where the people are? And that may seem very simplistic, but it's very significant and almost profound in many cases. And so we've had people who volunteered to call all of our seniors. I did a Zoom call one night with seniors. I had 380 some senior citizens. I don't know if they were all that senior, but anyway, but we had, 380 some people on a Zoom, and they just want to say, Pastor, how you doing? And what was funny was they started talking to each other. Hey, Eula May, how you doing, girl? How you doing over there? They were just, because they missed the fellowship. And so it's a multi-level dynamic here. And so the thing is, and I think Dr. Batchelor hit on it, you got to get in front of this thing. You got to be proactive about it. And sometimes there are some elements about it, like fatigue, like loneliness, that you need to put in the equation because it's more common than you would think.
Yeah, I think that's a really great point, and we're all missing fellowship, but it's also interesting to see how we've adapted in this new virtual world. I mean, we're talking about this tonight. I do want to make sure that we save some time for questions, but I would love for each of you to touch, sometimes we've talked about the reasons the three of us got the vaccine. How do you talk about the vaccine to people that you love? What vaccine advice would you give to your spouse or your partner or your family, your neighbors, your friends? Dr. Batchelor, how about you?
Well, I talk about the science and give them the facts because I think most people want information. They want to know the facts. So they want to know how the vaccines were developed, what the science is, whether there have been any side effects. So I talk about the fact that the clinical trials have included people of all backgrounds, have included elderly, people with lots of chronic illnesses, that the vaccines are safe and that they're very effective. I also talk about sort of weighing the risks and the benefits. So I think oftentimes people focus on some small chance of an unknown side effect from a vaccine, but you have to weigh that against the known risk of getting COVID and having serious complications from COVID. That's what we should be comparing. And if we are making that comparison, it starts to become clear that the vaccine is a better choice than taking one's chances with COVID. I also think we have to listen and be patient and allow people to process the information and get to their own place of comfort. So, I kind of learned that the hard way with my mother, with me constantly nagging her about getting a vaccine, and finally realizing that I needed to back off and let her come to the decision herself. Make sure she has the right information and make sure she, to correct any misinformation that she might have, and to let her see the example of me and my husband and others in the community getting vaccinated. And I was really surprised the other day when she told me, she said, I'm ready now. I said, great, let's do it tomorrow.
Good. That's good news. We want to hear that.
So that's what I've learned.
Yeah. How about you, Bishop Ulmer? How do you talk?
Well, I think Dr. Batchelor hit it on the head. I think there's like a personal timetable that goes on here, and you plant the seed. Information is very, very key. Information is very key. But I think Dr. Batchelor hit it on the head. It's like they're going to get it when they're going to get it,
Right.
And so we've had people who hesitated, and I did have a lot of people who were saying, well, Bishop, when you get yours, I'll get mine, And of course, some people were saying, I only want the one that Obama gets, and I want the one that Trump gets. I want to make sure that.
I heard that too.
Yeah, you know what I'm saying?
Yes.
But I think you do it. I think you do it very deliberately. I think you do it very deliberately. I think you do it very honestly. And in the religious community, I don't know anyone who has not been touched directly or indirectly by funerals, by deaths. We just had the death of one of the very key international leader here in Southern California, Dr. Price, died of COVID. I can't tell you how many preachers that shook. I can't tell you how many ministries that shook, and so ministers are dying, bishops are dying, pastors are dying, and so this thing it's an equal opportunity employer, if you will. It shows no favoritism, and so that's coming out more and more. But I think Dr. Batchelor is right. It's information, and many times it's information and patience.
Right. All right. Well, thank you both so much. I want to take a few questions from our larger viewing audience because there's some good stuff that I see popping up on the screen. So I'd love for you to weigh in. One question is, I already had COVID-19 and have recovered. Why do I need to get the vaccine? Aren't I immune?
Well, the reason that we recommend that people who have had COVID and recovered from it get a vaccine is because the level of immunity that we see following a COVID vaccine is actually higher than the natural immunity after an infection. So we still think it's important for people who've had COVID and recovered to get a vaccine. One of the things that's being researched right now is whether one dose of Pfizer or Moderna would be sufficient for people who've already had COVID and been exposed to it once. But we really want to get people up to a high level of as durable immunity as possible.
Thank you. And there's a ton of questions that we're not going to have time for, and I want to be mindful of everybody's evening. So thank you all the viewers, for your questions. But before we end, I'd really like to give each of you, Dr. Batchelor and Bishop Ulmer, a chance to just share a closing thought. So Dr. Batchelor?
So we focused a lot during this conversation on the vaccine, which I think is appropriate. But what I want to encourage people to think about is why our communities have been so vulnerable to begin with. And, that relates to a lack of access to quality health care, to, being essential workers who are not protected on the job, to living in crowded housing and having difficulty isolating. And we need to address these underlying disparities and inequities, and we need to address them now. We know that this is not going to be the last infectious disease that we're going to have to tackle, and we don't want to go through a repeat of this exact same tragic situation. So we need to start advocating for a better system of equal health care for everyone in this community. We're all connected and we need to get there. We're not there now. Right now, what we have is less adequate access and quality in low-income minority communities, and we need to change that.
Yeah, thank you. Thank you. Bishop Ulmer, how about you? Any closing remarks? We have a couple minutes left.
Yeah, mine is very short. I got mine, you get yours. And I don't mean to be flippant about that, but get it to be safe, but get it for the people you love. I'm dealing with a situation as we speak with a friend of mine whose father got COVID, almost died, and it's believed that he got it from her. And just the guilt that she's going through, the depression she's going through, saying that, wow, look what I did this to my dad. Did this to my dad. And so I would say, not only get it for yourself, but get it for the people that you love.
Great. Well, thank you both so much for your insight. We are near the end of our program. I'd like to thank Dr. Cameron Webb from the White House, as well as the two of you, our esteemed panelists, Dr. Batchelor and Dr. Bishop Ulmer, for joining us today for Embracing Our Community Live. Thank you so much to our partners at blackdoctor.org and to all of their viewers on Facebook and YouTube this evening. Cedars Sinai looks forward to continuing this important partnership with an ongoing series of events on issues important to our community. So to our viewers, I hope you learned a little bit more about our panelists. For more information about each of them, you can visit any of the websites up on your screen right now. And for more about COVID-19 vaccines or where to find a vaccine near you, please visit blackdoctor.org/COVID-19. Of course, if you're a patient of Cedars Sinai, you can always visit your MyCS link account for more information. And to all of you viewing, thank you for joining us and for sharing your questions with our panel. I knew we wouldn't get to all of them. There were some good ones that came through, but thank you so much for sharing those questions. We hope we've addressed your fears and answered some of your vaccine questions, and look forward to continuing these conversations. Stay safe and have a great evening. Thank you for joining us tonight.